Spectacular. Let's get started. The COVID-19 pandemic brought about a reckoning for healthcare. Without easy and consistent access to doctors, how were large swaths of the population, especially the underserved, to receive care if their need wasn't life-threatening but still important? The answer lay in telehealth, the practice of conducting care through virtual means. Telehealth means far more than just video chats to discuss chest pain. It also encompasses remote monitoring of symptoms and digital patient-provider connection. Indeed, according to the Heritage Foundation in 2020, America had already largely been trending towards an uptick in telehealth usage. The pandemic simply accelerated that transition and proved to both the American public and lawmakers the importance of telehealth in the modern health landscape. As legislation like the Connect Act comes into being that could change the healthcare landscape to better permanently incorporate telehealth, the healthcare community must grow the infrastructure and awareness to capitalize on this change. In 2011, the Office of the National Coordinator began an incentivization program to encourage the adoption of a technology called the Electronic Health Record, or the EHR for short. Overwhelmingly, this incentivization program has vastly increased the amount of health clinics receiving Medicare funding with EHRs to almost 90% of all clinics in the United States. However, simply having these EHRs is not enough. We saw during the pandemic, providers and clinics must be incentivized to actively communicate the uses of EHRs, such as direct patient-provider communication, streamlined appointment creation, and prescription refill to the patient. This summer, I worked under the tutelage of Dr. Brady Granger and Dr. Holly Viola, working to set up and execute an intervention to inform policy suggestions for electronic health records. Even today, great barriers exist in ensuring all patients made aware of these EHRs have access to it. The digital divide is real, and questions of technological and other literacy have come back into the forefront. To manage this, the ONC and Medicare must address the issue from both sides of the overarching problem. First, it's well documented patients have little idea what resources they have access to in the form of EHRs. While there are minimum requirements providers must meet in terms of the data they provide to Medicare and the ONC, if the ONC were to actively incentivize through increased funding for the clinic or community health resources, more patient-entered data, and more patient engagement, it would go a long way in leveraging this resource. Further, the ONC must acknowledge and develop solutions for the digital divide present in the populations served by many federally qualified health clinics and rural health clinics. There must be funding provided to these FQHCs and RHCs that allow clinics to partner with community organizations or services to provide devices or internet for healthcare purposes and otherwise to underserved communities suffering from a dearth of access. Over time, the intent of these suggested measures is to curb the issues illuminated during the pandemic and overall create a stronger, more beneficial healthcare landscape. Thank you.